Hello friends, welcome to Serum Medico. Today we are going to see about HIV AIDS. Before going in detail, I will discuss a case and we can go in detail. A 45-year-old man diagnosed with HIV 1 year back and is on medication. Now comes with complaint of nail pigmentation. So what is the reason? This will be the type of pattern of questions will be asked in the NEET and next. So watch the video completely and comment your answers. So we can go in detail. First HIV. We can first see about the virology. HIV. It is a retroviridae family. Retroviridae family. Retroviridae family means RNA, DNA, and RNA. And it is a single stranded RNA. And it is positive sense. What is positive sense? I will discuss about in features of virus in another video, and it is icosoheredal shape, and it is enveloped virus. And then we can see about the structure of the virus. It has three structural genes. GAG, GAG, ENV, envelope, and POL, polymerase. What is GAG is P24 nucleocapsid, and P17 matrix protein. These are the structures which help in the invasion of the virus, and we will discuss about in pharmacology also. And ENV has GP160 protein, and POL is polymerase enzyme. Then we can see about types of HIV types. It has two types: HIV type 1 and HIV type 2. HIV type 1 is most common type, which can be asked as MCQ, which type of HIV is most common, and it has A to K subtypes. And in India, which type is most common? Type C is most common. In India, type C is most common, which can be asked as MCQ. And in US, type A is common. And HIV 2 is global. And it has extra GP36 protein. Because of this GP36, it is more resistant to drugs. It's more resistant to drugs. So in this MCQs will be asked as what is the most common type? HIV type 1, and in India type C is most common, and which is the most resistant type is HIV type 2 because of GP36. Then we can see about the mechanism of HIV. Mechanism of HIV, there are two types: direct type and indirect mechanism. In direct, first viral budding occurs. viral budding occurs, followed by alteration in DNA of the human, alteration of DNA, followed by RNA processing, followed by I discussed about the GP120 protein. It helps in GP120 and CD4 T cell CD4 fusion, followed by syncytial formation. Indirect type is by like autoimmunity, intracellular. First it causes intracellular signaling, followed by like it acts behaves like autoimmunity. What is autoimmunity? Destroying body's own cell. So it kills the cells which was coated by virus, leading to cell death, which is apoptosis, pyroptosis, autophagy, like that, leading to all the cells are death. The immune response will decrease, leading to immunocompromised state. Immunocompromised. This is a mechanism. Just to know the mechanism, no MCQs will be asked. Then we can see about the signs and symptoms. Regarding signs and symptoms, there are many signs, and it will be asked as to which symptoms present in stage 1, which symptom is present in stage 2. I will discuss about this in detail in the next video. Most common signs and symptoms are, everybody knows, weight loss, diarrhea, and it can cause complication like TB, fungal infection, pneumonia, fungal infection. Oral candidiasis will be seen in some questions. The patient's oral cavity will be shown, and there will be whitish patch, and candidiasis will be seen. What will be the ultimate cause and options? You can rule out HIV, and next it can cause lymphoma. The most common site for lymphoma in HIV is CNS. Is primary CNS lymphoma. It can be asked as MCQ. And next, regarding in heart and HIV, most common heart disease in HIV is coronary heart disease, most common type, and most common cardiopathy, dilated cardiomyopathy, most common cardiomyopathy, and the most common in kidney can cause FS. Yes, I will discuss in a renal topic about this, and next we can talk about the transmission of HIV virus. Everybody will be thinking the main transmission is sexual route. It is correct, but the most common mode of sexual transmission is heterosexuals, not homosexuals. Heterosexuals are the most common transmission of HIV virus, not homosexuals. And efficient mode, which will be the efficient mode, is blood transfusion. And mostly medical professionals will have needle prick. So these are the transmission type. And regarding heterosexuals, which is most common efficacy, which is the most common efficacy is anal sex. Anal sex more than vaginal. sexual transmission, because so that heterosexuals are most common for HIV. So can ask as MCQ. Then this is the transmission, and next we can come to diagnosis of HIV. First we can see about culture. Culture is PB, MC, peripheral blood, mononuclear cell, culture want 28 days to grow the virus, so mostly we don't use culture, and it can be used, it is under trial for you developing vaccine also. Then we can test by antigen detection and antibody detection. For this is the most important MCQ which we asked. Which antigen, first antigen to be detected is P24 ELISA. P24 early diagnosis is using P24 ELISA. Which antibody, first antibody is GP41 antibody. And for antibody detection we use three types of test. Which is the best test is Western blot, and the most common test used is ELISA. And nowadays we do rapid test also. So these are the MCQ. For antigen P24, for antibody GP41, for early diagnosis antigen P24, and best is Western blot, most common is ELISA. Next we can see about PCR. In PCR we can do DNA or RNA and RNA. In DNA it is qualitative, so we can use for diagnostic. DNA is qualitative and used for diagnostic. RNA is quantitative, how many quantity of viral load is there, quantity. So we can check for prognostic factor, prognostic index. So best marker will be viral load more than CD4 count. Viral load more than CD4 count. It is asked as MCQ. Viral load. Then regarding treatment, it is test and treat strategy. Irrespective of CD4 count, if patient is HIV positive, start the treatment. Then we can discuss about the pharmacology of The drugs used for HIV are fusion inhibitors and reverse transcriptase. It is nucleoside and non-nucleoside, and integrase inhibitors, proteasome inhibitors, and CCR5 blocker. We can talk about in detail. First, fusion inhibitors. In fusion inhibitors, only one drug, enfuvertide. The site is GP41, and it is the only available injectable ART, antiretroviral therapy, subcutaneous. Which drug is only injectable ART subcutaneous? Enfuvertide, and the side effect is allergic reaction and it can cause pneumonia side effect. Then CCR5 blocker. CCR5 blocker is a viral entry blocker. It is Maraviroc. Site is CCR5 and the side effect is orthostatic hypertension. Then comes the main nucleoside reverse transcriptase inhibitors. The main thing is it is used for HIV type 1 and type 2. In this, mostly the questions will be based on what is the side effect. Like I have asked the question, I have discussed a case in the front, you can know about it. What are the drugs of NRTA? It first zidovudine. Zidovudine main most common side effect is myelosuppression, anemia, cytopenia, so that and all. And dydroson, it is diarrhea, and pancreatitis, mainly pancreatitis. It will be asked which drug cause pancreatitis, which antiretroviral drug cause pancreatitis, dydroson. And stavudine is a main important drug because it is an enemy, because it is the most causing side effect drug, because the question will be asked as which drug cause severe neuropathy, stavudine, severe lactic acidosis, stavudine, severe lipodystrophy, stavudine. The antiretroviral drug which is worst is stavudine. Next, abacavir. Abacavir will be asked as important MCQ because it causes Stevens-Johnson syndrome. In Stevens-Johnson syndrome, the gene affected is HLA-B5701. It is important MCQ. Like carbamazepine, which I will be discussing in CNS drugs, it will also cause Stevens-Johnson syndrome, but the HLA will be different. So it is important HLA gene you have to keep in mind. And abacavir can be used in renal failure patient also. So these are the important MCQs. Then lamivudine, M3-acetabine, and tenofovir. This is also NRTI. The main important thing you have to know is which can be used for HIV type 1, type 2, and hepatitis B also. Lamivudine, M3-acetabine, and tenofovir. These three can be used for hepatitis B also. And lamivudine, M3-acetabine, and cytidine analog. But tenofovir is a nucleotide blocker. The mechanism is different, but can be used for hepatitis B virus. Next is best NRTI is lamivudine. And worst NRTI, I said no, it is stavudine. This nail pigmentation is caused by zidovudine. I discussed the case in front. This zidovudine. Questions will be asked like this only. Next, NNRTI, which can be used only for HIV. Some questions will be asked, 4 drugs will be given, and it will be asked as which of the following is not NNRTI, or which of the following is NRTI. Both type of drugs will be given, and they will be asking to rule out. So first NNRTI, it has 2 generations, first generation, second generation. First generation drug is efavirenz. It is main causes neuropsychosis and teratogenic. Which drug is teratogenic? They will be asking. It is efavirenz. And nevirapine is liver damage. Many of people have known nevirapine is liver damage. And another drug is delaviridine. And second generation drug is rilpivirine. It causes QT prolongation. And etravirine and doravirine. So main thing you have to keep is efavirenz, neuropsychosis, and teratogenic. Nevirapine is liver damage. Next, integrase inhibitors. Integrase inhibitors are gravir, valtigravir, eltigravir, dolutegravir. And a drug is known as cobistat. What is cobistat? It is a booster for eltigravir. It has no antiretroviral action, but it acts as a booster for eltigravir, like inducing the enzyme, like that. Next, protease inhibitor. Protease inhibitors are navir, like sakinavir, indinavir, nelfinavir, ritonavir, amprinavir, fosamprinavir, lopinavir. And which is the best navir protease inhibitor is saquinavir. And one MCQ will be asked, which of the patient is on antiretroviral therapy and comes with pain in the loin, what will be the reason for that? You can diagnose it as kidney stone and nephrolithiasis, and the main drug causing nephrolithiasis is indinavir. It is an important MCQ. Kidney stone, nephrolithiasis, HIV patient, antiretroviral drug, indinavir. And ritonavir is also a booster drug and also acts an antiretroviral action. And the main side effect of the protease inhibitor, all the protease inhibitor, is lipodystrophy. The main side effect of protease inhibitor is lipodystrophy. And there is a drug known as tipranavir, which causes intracranial hemorrhage. It comes under sulfonamides group. I will discuss in later. Next that's all. And next, other drugs which are under trial and used for HIV are tesamorelin, which is used for HIV-induced lipodystrophy, because most of the drug causes lipodystrophy. So it is under trial tesamorelin, which can be used for lipodystrophy, and croflamir, which can be used for HIV-induced diarrhea, which is also under trial. An antibody used for HIV is emalizumab, and maturation inhibitor, which is also under trial, is bevirimat. Next, the pre-exposure prophylaxis. Which drug can be used for pre-exposure prophylaxis? M3-acetabine and tenofovir, which are NRTI, which I have discussed about before, which is used for HIV type 1, type 2, and hepatitis B virus also. Emtricitabine and tenofovir can be used for pre-exposure prophylaxis. Next, post-exposure prophylaxis. There are two regimen. They are tenofovir and lamivudine combination, which should be taken within 2 hours. One tablet should be taken within 2 hours and once daily up to 4 weeks. If you are working in a casualty or you got a needle prick, you should wash your hands. And if a patient is HIV, you should start the drug within 2 hours. Take one tablet, tenofovir and lamivudine, and once daily for 4 weeks. Or another regimen is loponavir and ritonavir, which will be taken within 2 hours, 2 tablets, and twice daily for 4 weeks. It is important pre-exposure prophylaxis for all internship. Keep in mind. And that's all regarding HIV. Thank you for watching the video. Give your comments in the comment box and subscribe and like and share the video. Thank you so much.